I'd like to call the meeting to order of the Board of Leavenworth County Commissioners. I'd like to invite everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to begin with a moment of silence, please. Roll call, begin with Commissioner Stiebens.
Aye.
Commissioner Schimke.
Here.
Commissioner Smith is present, and Commissioner GULBERTSON.
Here.
And Commissioner KAAZ.
Here.
All commissioners are here, are present. Do we have any public comment on any agenda items today?
I don't believe we have any public comment for agenda items.
All right. Do we have any administrative business at this time?
Last week, the Commission had asked if I could have the County Health Officer bring in a few folks to talk about masks, and Jamie Miller is here. I'll turn it over to him.
All right. Mr. Miller, how are you today?
Good. At last meeting, you requested that our medical director and or medical community come to discuss the issue of masks with the board. Today, I did bring with me Dr. McBratney, who is the medical director of the Health Department and EMS Department within Leavenworth County. And we also have Dr. Richard Whitlow, who is also here from the medical community to answer any questions that the board may have.
Okay.
So,
Okay.
turn it over to the board for questions.
Commissioners have questions?
I have a couple questions.
Go ahead, Commissioner.
And this is not just specific to masks. It's been on the media, the use of hydroxychloroquine being something they use to treat malaria. Many overseas missionaries and people that go overseas have used it. Some advice is that we use it as I don't know if a preventative would be the word, but as some kind of to offset the effects of COVID-19. Could you comment on that?
From my understanding of that is that's a no-go, that there's no evidence that that works.
So that's your okay. Is there a cite for that, or is there? Because I've heard conflicting things.
President, that was a good deal and made it specific evidence from a political perspective. And as countries and people tried to use that, it was found not to be effective at preventing any complications or side effects of the COVID.
So hydroxychloroquine, in your view, or in what the medical literature you've reviewed, is not to be used at all for the treatment of COVID-19.
Correct.
I would say that I've used it on mission trips. I've personally been on it for malaria prophylaxis. And China and Italy told us before COVID got here that it didn't work. But, of course, we did our own studies, and we haven't found benefit yet.
Okay. Second question is, on the opening of the schools, the Tonganoxie school board president visited with me, and he was concerned that when they opened the schools, if there was a case, like if you come to a case, you open the schools and then you have a case. So what would the public health response be? Let's say Tonganoxie opened and you had a case.
We would conduct the same contact tracing as we're doing in the public right at the moment. Obviously, that classroom that the student and or teacher would, depending on who is positive at that moment, we would do the contact tracing and quarantine appropriate based off of that contact tracing. Realistically, that probably looks like that classroom specific. That does not mean just because we have one in a school that we're going to shut the entire school down. But those that are in close proximity within a classroom, there will be quarantine of those individuals that are contacts of that positive within that classroom.
Well, that's one of the concerns with opening up the schools is if you open and then you have a case, then then you have to reclose, and you've lost that education time.
And no warning for parents at work.
Right.
So
And
that's
it's
why we're focused.
Okay.
Jamie, we talked several weeks ago that contract tracing is a great tool, obviously, and early on it made a lot of sense. As you go on and it becomes more community spread, how do you contact trace when a person's been to 10
Contact
locations?
tracing on positives, though, eliminates future spread based off of those that we know are positive and we can quarantine. That's the importance of contact tracing and testing. That reduces, so if we do have someone that is positive, we can identify and test them. We can quarantine them as well as their family, so that family doesn't go out and then infect on top of that. So contact tracing is still important. Yes, there is cases that are coming from community spread. It is wide community spread at the moment on a lot of cases where it has come from, but what we're trying to reduce and how we're keeping our numbers where they're at is the quarantine and testing procedures that we're doing and the contact tracing based off of that. So if you become positive, we would look at others that you've been in contact with, and we can quarantine, test, and go forward from there. So if you expose, say, Commissioner Smith and Commissioner Stieben, we can look at their families as well as close contacts, and within those 14 days, if they become positive, we already have them quarantined. They were not out in the public and spreading the virus and exposure to the remainder of the community.
We're still mostly falling between a 7 and a 10% positive rate. So, I mean, going back to the very beginning, we had all these people that were self-diagnosing. Medical doctors were diagnosing patients without seeing them, and the facts were that of all the people that get tested, 7, 8, 10% of them were the only ones that were positive. And now we're running around going, okay, well, we've now learned a lot more, and that 80, 90% or better of people are asymptomatic, which is even furthermore challenging because you only know to stay at home if you have symptoms. If you don't have symptoms, you don't. So you go to your place of work, you go to Walmart, you go to your grocery store.
Which goes hand in hand just with what you're saying, Commissioner, and that's why social distancing, hand washing, and masks are so important, because you could be walking around feeling 100% asymptomatic, no symptoms whatsoever, and spreading it as you are going around without that mask on. The mask is a mitigation strategy to reduce, if you are that asymptomatic carrier out in the community, that can reduce our spread in our community because, again, we know that there's scientific evidence that will reduce droplets on which the the virus is carried in.
Okay. Another question related to schools, and because I've talked a lot to the school people, is if they have fall sports, and I guess that would be
They are going to have fall sports, according to the Kansas Association.
Well, that's a threshold question. I want to hear your recommendations. And then the second thing is then they're talking about wearing masks while they're in soccer practice and wearing masks while they're scrimmaging. And some of this can become a public health problem, just the fact the exertion and the mask. And how do you offset that?
So Olympic athletes exercise with masks on all the time. Hong Kong, Asian people, they always have masks on.
But we haven't typically done that,
Right, but genetically we're the same, so.
So you're saying it's just
other countries
fine?
use masks, and Olympic athletes, skiers, they often wear masks when they're going downhill. They exercise at full endurance with masks on.
So there is no medical evidence that wearing a mask changes your respiratory capacity. It doesn't lower your carbon dioxide. It doesn't raise your carbon dioxide. It doesn't lower your oxygen. So the argument of wearing a mask during physical activity, there's no change in performance. It's hot, it's uncomfortable, it's irritating, it looks terrible, but there's no change in performance or cardiovascular function.
Of course, if a person had asthma or a person had something
No
like
difference.
even in the case of asthma.
Even in the case of asthma or COPD. People with asthma and COPD are in the top tier risk of developing COVID complications.
So you would recommend, if they do fall sports, that they be masked even if they're in scrimmaging and out playing the game?
Maybe the only fall sport that wouldn't apply to is tennis singles.
Okay. That's a question that, the football players and all of them should be masked, in your opinion.
They're close, they're breathing hard, their microdroplet expulsion is really high. The thing about masks is that masks don't protect the wearer. I don't wear my mask to protect me. The evidence is that when I expel microdroplets, they're in the size of about 50 to 200 micrograms. Okay? The mask stops that close to my face. As it distances from my face, the moisture evaporates, and now you have a little virus, which is like, microns. I mean, small. They go right through my mask. So if you have the disease and you're not wearing a mask and you cough on me, I have a 70% chance of contracting that virus. I've got a slide there if you want to look at it. If you have a mask on and I don't have a mask on, that falls to 5%.
So in sports, you would recommend masks, like the kids all be masked up?
Absolutely.
And okay, that was just a question I had from the superintendent, not the superintendent, but the one of the board members.
Absolutely.
Dr.
They
Brady,
do not need to be medical masks. They can be 3-layer cotton snug-fitting masks. Works perfectly fine.
you mentioned areas of incredibly high population where masks have been commonplace for a long time. One of my concerns has been we're applying the New York methodology to the Midwest, right, where we all drive to work generally by ourselves in a vehicle. We don't take the subway. We generally don't have 20 people in a steel tube with recirculated air. You think about an apartment building, which almost everything's multifamily in New York. There's a lot of recycled air, right? So just in general, going back to the very beginning where the idea was you want to slow, which has always been the argument. Slow. At what point have we slowed? I don't think we've ever thought we were going to beat it, or at least that was never the rhetoric at the very beginning. It was just make sure we don't overrun our hospitals. And as I understand it, and that's my question for you guys, is Missouri and Kansas, especially in the Kansas City area, are they not number one and number two as far as hospital resources per capita, as far as number of beds per people, which you don't have in, say, in New York or Chicago or some of these highly dense areas?
Okay, yeah. Italy was our first, after China, the biggest outbreak.
Sure.
It was in the northern aspect of Italy, which has way more hospitals, way more ventilators, way more wealth than we do in the United States. In Leavenworth, we just lost over half of our ICU beds. We lost our only pulmonary bed. If we have somebody on a ventilator, we won't keep them in Leavenworth anymore.
Well, that's a whole other deal. That's why they all go to Johnson County. We got a whole problem there. I agree.
Yeah, but I mean,
why not?
our numbers are, so I'm trying to say we don't have the hospital beds we had. And our numbers in the last week have gone up in the Kansas City metro area.
Is St. John's being overrun?
I didn't hear the question.
Is
St. John probably is not taking COVID patients.
Okay, so they're not even
I'm
taking.
attached to
They
St.
don't-
John as much as you are, but I'm pretty sure they're probably not even managing a COVID patient in St. John.
Okay, so they're not being overrun by COVID
No,
But they don't
patients.
have a pulmonologist.
Okay.
Okay, the metro hospitals, to your comment, overserved. Certainly in Johnson County, Johnson County is way overserved by physicians, mostly specialists, not by primary care. In terms of hospital beds and ICU care, every system that I'm aware of is running at about 98% capacity right now.
Which is
And compared to
good.
2019, what would that look like?
But
St.
that's,
Luke's is probably 2.5 times the volume of COVID and persons under inspection than they were in April when it peaked. 2.5 times that volume.
Is it true though on the ICU beds that we had a backlog of elective surgeries, and that a lot of the ICU beds that are being occupied now are elective surgeries that have been backlogged and not necessarily COVID-19 cases?
I don't know for sure, but I would hope that an elective surgery wouldn't result in an ICU stay.
Well, I mean, we have some serious. I mean, we had some surgeries that were delayed, and that what I have been told or understand from the literature is that some of those elective surgeries that have been delayed have resulted in filling up some of our ICU beds.
That's probably true to some degree.
And
Now, then again, I would hope that my elective surgery didn't result in me being in an ICU.
yeah, all of us would have. But when you delay those surgeries and then the conditions kind of get worse, it could result in that. One question I had, and I've addressed this with Jamie, is in the 2019-2020 influenza season in Kansas, we had just over 1,150 deaths in the state of Kansas from influenza or influenza pneumonia-related deaths, according to the data from the state of Kansas. So far, COVID-19, last I looked, it was like 342 since March. So we're getting close to the 6-month period. If you double that, you're going to be under the number of influenza deaths in the state of Kansas. Now, that may not be true nationally, but in the state of Kansas. So my question for the public health community would be this. We didn't mask everybody up for influenza. We didn't make all of these changes during that season. I know we don't have a vaccine, but a lot of questions from people is why with the numbers being so low, why are we reacting in this way?
Well, for one reason, it's novel, which I know you know that. Second off, we have way more travel than we did in 1918. I mean, we have cars that go.
Referred to 19.
No, it's the 2019 and 2020. Yeah.
Oh, because we have a vaccine.
So
I'm talking 18, 19.
but I guess, when you look at overall numbers of the total numbers, people are questioning
I would postulate, what did we do different with COVID than we were doing with influenza? Nobody had a mask on last year during the influenza season.
Right.
Nobody. Some of the population wears a mask now. The numbers are increasing. It's voluntary. But we're still probably not at 50%.
Well, your box stores, I've seen a big improvement in the box stores.
It's
It's
better. Okay, but I think it's better because the businesses have taken the role of protecting the public.
So what we're already doing has already lowered the numbers below what the regular flu did.
I think what we have done in the past 6 months has caused the difference between the influenza season and this, if you look at those raw numbers.
Being under the
I think everybody would
voluntary
agree
mask.
that even if you went to 2019 and if you were looking at influenza, for example, there's plenty of studies that would show that if you wore a mask, no different than those countries we mentioned, 24/7, 365, practice social distancing and wash your hands, you'll see improved numbers.
Right.
Cold, flu, name the illness.
We've known that for hundreds of
But
years.
we think our flu season lessened because people wore masks because of COVID.
So the numbers are good under the voluntary mask order that we have now.
They're better. Could they be better? Yes,
Yeah.
they could be a lot better.
Yeah.
The thing
It
about
could be a lot better.
the flu is most people have the flu, they're sick. You look at them, you know they're sick. With coronavirus, we could have, I've been separated from my husband 21 weeks. I don't want to bring it home to him.
Right.
So, because I don't know, I won't know maybe 4 or 8 days, maybe I'll never know I had it.
But my point is, under the voluntary system we have right now, our numbers are good.
Right, but when Dr. Whitlow, I haven't, all my patients, when I tell them they have coronavirus, are like, oh my gosh, what if I infected my grandma, my spouse, my coworkers? Well, did you wear a mask? Yes, but, there's always that but. When you went to a party, you didn't want to go. I would say every one of my patients has felt awful that they didn't wear a mask 24/7.
Well, one thing I have a problem with this is how it's not your fault, it's the federal response, it's the advice we've been getting, because I have a document here that's from the World Health Organization. It's their interim guidance. It was published June 5th, and I looked online before, and this is the latest document they have released. And on June 5th, they wrote that at present there is no direct evidence from studies on COVID-19 and in healthy people in the community on the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19. Now that, I know you could say, well, maybe things have changed since June 5th, but we've been getting a mixed message coming from the healthcare community on this, because right here they're telling us that it's not effective, and then we're hearing from other sources that it is, and then that doesn't even include the public weighing in.
Correct. It's very confusing. But what they mean is that it may not protect you. If you're the only one wearing a mask in this room, I won't be protected with a mask unless I wear an N95, which we don't have enough of. But if we're all in masks, then it's protective. And we have 172 studies that prove mask effectiveness in that part.
And I don't think anybody here disagrees with the effectiveness of masks.
Right.
It's when you get down to the issue of the mandate.
So, to comment about the World Health Study, okay, one, there are no gold standard studies out there. There are no randomized double-blind studies anywhere in the world that look at the use of masks and not the use of masks. What we're left with are observational studies, cross-sectional surveys, and anecdotal studies. I included a couple in the handout that I gave you. The example from Thailand is dramatic. I mean, dramatic. The hairstylist in Missouri, 140 contacts from 2 hairstylists that were positive for COVID. The stylist and the client both wore masks, no transmission to the clients.
But they did transmit to their families. They didn't wear their masks, of course. I'm not saying wear a mask at your house.
Okay.
But it shows that they were transmitting COVID. They just didn't give it to their clients because they were in a mask.
So we're not advocating wearing a mask at home. We're not
Right.
advocating wearing a mask if you're out biking, if you're in your car, if you're walking on a street. What we're advocating is if you're in close contact with a lot of people, everybody should have a mask on. Everybody should try to maintain as much distance as they can to mitigate the spread.
And that's what
But
the
the same
county's
argument you
advocating.
make in public, you could make for private. So in your homes, I mean, you could make the same argument. If your spouse also sees a lot of people, even within your own home, the same logic would make sense. And I've sat here and said, whether it's 1% or 2% more effective, it's still more effective.
Right, but it's just easier. We have enough space for us to separate. We have, I have 2 bathrooms. We have 2 bedrooms.
Sure,
We
sure.
can do it. But if I lived in an apartment, you bet I'd have a mask on if I was going home. Because my husband's older than me. And, he has more risks than me.
And so you think once a vaccine is created, and of course AstraZeneca, and I'm sure none of the pharmaceutical companies have anything to gain by that, but once it has been released, you no longer support the mask, or just think high traffic masks should always
How
be
many
worn?
people get vaccines and that it works?
So what's the flu shot numbers? I don't know how many people of 300 million in the U.S. get a flu shot. Any idea?
Probably 65%.
But
I included a slide regarding COVID antibodies in the handout. So if you look at people who have mild COVID and you measure their antibodies, which you think should be protective, the antibodies levels decline at 120 days, and they're probably no longer protected. So unless they hit the vaccine absolutely on the nose and find the right antigen part of COVID that makes you immune, the vaccine may not work. So I would not rely on that.
the reason we're skeptical is coronavirus causes about half of our children's runny noses already, and we didn't have the
Sure.
vaccine ahead. It's not like when SARS and MERS came out, which is also a coronavirus, that we weren't trying to find a vaccine.
The thing mutates like piglets in people. I mean, it really does.
Well, that's how most have always understood viruses to be, right? Is that they continually mutate. So how do you vaccinate for something that continually
It's the
changes?
same thing with the flu virus. I mean, it's always a catch-up game.
Yes, every year.
Right. Sometimes flu shot's effective. Sometimes it's not. Sometimes
Correct.
I'm assuming someone makes money. I'm not sure who, but usually you
Well,
can track
it's
it
not
on someone.
off, it's not physician office.
I understand. It's not even in this room. I agree. This room is not benefiting.
I'll go on record to say we lose money when we vaccinate kids in our office.
Yeah, but for the record,
Reimburse what our cost is.
it's for the record, it's Dr. Whitlow and Dr. McBratney at the podium. I think we forgot to get your names, but we're good.
Can I also mention the other doctors that are requesting mandated masks? My partner, Dr. Brockert. I have St. Luke's physicians, which is Dr. Whitlow, Dr. Yoakum, Dr. Dander, Dr. Coleman, Dr. Seymour, Dr. Mills, Dr. McAllister, Dr. Reichstatter have all reached out to me, or I've spoken with them about mandated masks. The others, I've not had a single physician say no. I just didn't. I'm on vacation this week. I just didn't reach everybody. I've had multiple physicians that don't live in town, that work in town, and I didn't include them in the list, that contacted me last meeting. I think I told Reagan I spent like 7 hours on the phone calls with physicians, appalled that we don't have a mandated mask.
What would be the metric? I mean, I think this touches on what Commissioner Schimke said. If we drafted up a mandate, I think we would want to have a metric where if case numbers or something hit a certain level, that we could drop we could drop the mandate at that point. Or I don't think we just want to do a blanket mandate. Is there a number that you had in mind?
There's a public health metric out there, and it's also backed by CDC, that it's the 5%, as long as your 7-day average is at 5% and decreasing. So if you're at 5% and under and decreasing, and also a 14-day caseload per day is also decreasing. So in that 14-day average, your daily caseload is also dropping. That's also the matrix that is being used in the Kansas City Metro, also for Johnson County and schools on what to be open, what not. It's 5, 10, and then 15, and then above, and we're working on. Johnson County just yesterday put out that matrix also for the schools. That's also the matrix. Johnson County is currently in yellow, and again, they were a county that went into mask as mandatory. They have now came out of the red and into the yellow for their jurisdiction, which means their caseload has either leveled off and or is decreasing for the 14 days, and they're at that 10% or under. They're at 7.7 right now.
So, Jamie, that's a testing matrix. So what's the matrix for if you look at a population and say less than 1% of your population is tested positive? Now, the funny thing about numbers is what you can do with them. If you go from 1 case to 2 cases, that's a 100% increase. So right now we're under 1% of our population.
But that's also why it's a moving average, and it's not just a daily. If we were to look at that on our Monday, we were at 23% positive. We don't use that. That's part of that percentage that we're going to use for our average. That's why we're not up over 20. We're still at that 12% currently just for our community. So where I was talking last week where we were at about that 10% mark, and we know we're going to be going up, just up through today, we're at about a 12% right at the moment, going up on our percentage of positive. Our caseload is still, if you look at it on the average, we've plateaued over the last 5 days that we're looking at on our averages for caseload per day. And what people aren't also looking at out in the public is they're looking at when we publish our numbers. Remember, we're publishing numbers that may be at 3 days. So when it shows 25, that doesn't mean we took on 25 in a day. We have to look at what caseload is coming in on testing per day, and that is what's being recorded, and that's what we're looking at to make those metrics.
And we're testing positives. To my knowledge, there's still not mass antibody testing to try to do any type of modeling as to how many people we think have had coronavirus. They could have had it last fall, could have had it January, could have had it March. I mean, again, before
what we're after, though, currently, Commissioner, is active virus. That's what those that happened back in March. That is an obvious matrix that can be looked at. But what we're after today is who is out spreading it, because that is going to be the disease process that we're looking at as of today. How many people are out spreading the virus, and that's where that PCR test comes into play of active virus. And that is what we're looking for, is how much active virus is out there spreading, because that's what's continuing. As Dr. Whitlow stated, we don't know what the serology is going to give us in regards to how long, even if we have a serology test, yes, it can show that you had it, but we don't know if that's going to defend off, again, from you being reinfected down the road. Because as we said, 120 days, there's a pretty good substantial in some of the studies right now that is falling off. Well, it's still going to be that active virus that can still go back, and you can be resusceptible at that point.
And I don't think anybody, as far as reopening, whether it was businesses or schools or anything else, assumed caseloads were going to go down. They were obviously going to go up. And that's where we get to the healthcare community going, what we can or cannot take as far as caseloads. At what point do we overwhelm? In New York, it takes very little to overwhelm, because with 25, 30 million people, they don't have the resources that a KU Med, an Olathe Health, a Shawnee Mission, an Overland Park, a Johnson County, a Casey Mo, go on down the list, have relative to our population, St. Luke's.
Right, but if we get overwhelmed, wearing a mask won't work for 2 to 3 weeks. And some of our COVID patients are in the hospital for 3 months or longer even. So the deaths don't occur for months and months. And if we had a mandated mask policy, it'll take you're going to get lasted for 2 weeks before you see any improvement.
So is the number from the state of Kansas indicated that the average age of cases in the state of Kansas has dropped to 37 is average age of the COVID case. Now, that would indicate that the severity has dropped, correct?
In the younger people, but they still are spreading it to their grandparents.
But the severity, as far as, like, we haven't had a death in Leavenworth County since May, so the severity of the cases has dropped, correct?
I would not say that.
No, I would not either.
I would not say that.
We shut down our nursing homes very quickly, and that helped keep the deaths.
So if the age has dropped to 37, is the average age, obviously younger people don't get it as severely as elderly people in all this literature I've read, so it would have to be that it wouldn't be as severe.
I wouldn't say that.
So what? Help me understand that.
Less than 10 is supposedly fairly protected. Okay, I mean, the 0 to 10 are pretty protected. They're not getting it for the most part unless they have underlying illnesses. The middle-aged people are getting it. What I think we don't have in the numbers is we don't know how sick these people are. We don't know how many of the cases are in ICU, okay, and dying. What we know is how many positives we have and how many dead we have. We don't have the middle numbers.
And what we also are just finding out, because it's just been here 6 months, is that 3 months after coming off the ventilator, coming out of the ICU, they're back with trauma to their lungs, they're having heart attacks, they're having blood clots, they're having strokes, encephalitis, memory change, mood change, suicide. There's lots of post-COVID complications that we're just now, and we don't count those. We don't have technology.
So you don't agree with the statement that people below 40 have COVID in a less severe way?
No, I don't. I think the other thing, is that, the 40-year-old population are working people. I have not had a COVID patient that hasn't missed less than 4 weeks of work. They want to work, they can't work. They're fatigued, they're tired, they're short of breath, they have debility. That's an economic thing. Not only is it a tax thing, it's an income thing, it's a mortgage thing, it's an I can't pay my bills thing. So preventing the illness, even if it's mild and somebody is at home and is going to survive, has huge value. Huge value.
This is Commissioner KAAZ. I would also like to interject that there are a lot of people that I have spoken to and that I am personally aware of who have been positive in their 40s or early 50s with the COVID virus, were never hospitalized. However, their long-term, as it drags on, all of the things that they're dealing with post-testing positive are pretty significant.
I would agree that I'm seeing that also.
I think one of the areas you're going to, Mike, and correct me if I'm wrong, but if you're immunocompromised or if you're of an age, whether it's coronavirus, whether it's pneumonia, whether it's the flu, there's a higher risk of complications.
Correct.
At the end of the day,
That's right.
if my grandmother, who's compromised, gets any of the things I just mentioned, there's a very good chance things will not go well, coronavirus or otherwise. So I think we're kind of stating the obvious in that regard versus what may happen to a
Or the flu. Even the flu can, with the older population, really be detrimental.
In the scheme of things, in the medicine world that we live in, there are not many interventions that we can implement that have no side effects. They're very, very cheap, and they protect a huge number of people. And masking and distance is one of them. It's a little irritating, it's sweaty, I get a rash at the end of the day, but I get to wear a cool fashion statement and I can change it up every day.
It does look great.
Thank you.
It does.
Now, one thing I would wonder about is we have 91 counties that have exempted themselves. But that doesn't mean, just because they exempted themselves from the governor's order, that doesn't mean that their health departments in those 91 counties aren't very actively encouraging masking in their community. And the Walmarts, the Home Depots, and a lot of times I like to see private decision making as opposed to public decision making. The private decision making is being done positively, and they are masking up in those communities. So I think our percentage of cases in the counties that are not requiring masks compared to the counties that are we really seeing a disparity, or have we had any studies on this?
Well, we're seeing that in Johnson County and Douglas County. They implemented masks earlier, and their numbers are going down.
Douglas County also implemented a prohibition on the bars.
A week after the.
Yeah.
To me, if we want our community to stay open, we wear a mask. If you want your kids at school to wear a mask, we put a mask on. How do we tell our kids to wear a mask if we're not wearing a mask? If they hear us arguing in our house about masks, why are they going to go to school? We can't put that on the teachers to have to enforce mask wearing if our parents are not agreeing with it.
Well, and that's one of the challenges we've had overall is that if you have a state mandate that happens on a Thursday night and every office is closed on a Friday, and how do businesses implement the right protocol, or how does a city or a county enforce something that is impossible to enforce? I mean, to some degree, businesses, private decision making, you have to, again, weigh all of those things in consideration. If you're a small shop that sees 8 people a day, or you're a Walmart and you see 8,000, those are not necessarily one and the same. But
And the school boards are determining.
This is Commissioner KAAZ again, but one of the things that some of the businesses have dealt with, because there is no mandate within our county, are individual citizens maintaining that they do not have to wear a mask, even if that business requests that they do.
my answer to that, Commissioner KAAZ, is we cannot fix stupid.
Oh, I agree.
A business has always had the right to have any policies in place that they choose on their patrons, and they can refuse service if you do not comply.
So, in comment, Commissioner Stieben, about private decision-making and mandate, I think our country has a long history of mandating behaviors that, upon me, okay, that affect you. Smoking in public, driving while intoxicated laws, concealed carry laws, texting while driving. Those are bad behaviors that will affect me, but they also affect you. And it's okay in my mind for the government to step in and say, hey, Whitlow, you shouldn't do that because you may kill 2 people on the road. I don't know if I have the virus or not. I have not been tested. I wear a mask wherever I go because it protects you. And yeah, it's my decision. But I would like to see the government from the top down, not just Leavenworth County, but I think the biggest error here has been an error in communication. We have not had one clear message come out of this from February or March. There's always been the political finance decision, and then there's been the medical decision. If that message was synced, people would be on board. They would do a lot better with this. They would have done a lot better with this. And I think our economy would have done a lot better with this.
I agree with you. I think one of the problems is Commissioner Schimke dealt with it was the fact that the governor's order came out 2 days ahead of 4th of July. I had always said if we had laid the groundwork for that 3 weeks earlier, and in this World Health Organization report, it has an entire section on the manner in which you use masks, and there is certain protocols for using the masks, or they can cause public health issues themselves. And I don't want to read it, but I can just share it with you. But like also the issue of creating medical waste. I see masks thrown out on the parking lot. That is medical waste. It needs to be handled in a certain way. And if we don't educate the public on the proper use of the masks, and we just throw in as tomorrow you're mandated to all wear masks. I would say if we were going to implement this, that we should have the metrics to where it goes. When the number hits this, a mask order goes in effect. If the number hits this, we close down the bars. I mean, then we have a metrics that the public understands exactly. You know, if our cases, or I don't base it on morbidity or base it on hospitalizations, whatever you're going to base it on. But when you hit those numbers, then this happens automatically. And that would be easier for the public, because the public is just seeing the governor come out and, 2 days from tomorrow we're having a mask order. And seriously, we do need to educate people on how to use masks. That you're not supposed to be touching your face, and you're not supposed to be, if you do mess with your medical mask, you're supposed to get a new one. And that there are public health instructions on these things. And I'm not saying necessarily that it's not the best thing, because I think wearing a mask, I've been promoting it from the very beginning. Put a mask on when you go somewhere, but to not lay the groundwork for whatever the mandate's going to be. And I don't really see our case number justifying a mandate right now.
I got a couple of questions.
Go ahead.
One is about the numbers reporting. Even though the numbers that we're looking at, you even said, look great under the voluntary mask system that we have right now. But even though that's the case, that the numbers look good right now, when you report numbers, how do you know which number of positive tests that person is on? Say that person got tested 4 times. How do you know that's the 4th time they got positive tests?
When our numbers come back, Commissioner, if you really look at the number of tests that we've performed in Leavenworth County, there's individuals that are on test 14. We don't count test 14 for that individual. It's by person. So we're looking at person tests as it comes in, not by how many tests a person has.
So
when I report a positive case, if you test positive 3 times because we're trying to maybe get a negative test for you, that's not 3 positives. That's a single positive back when you first tested positive for the case.
How do you know that?
It's in my system. We have EpiTracks through. Every test is tracked and linked in a database.
Okay, so the one that was counted as positive but then retracted the next day.
Say that again?
He's talking about the one that wasn't a Leavenworth County person. He counted the number and took the number away.
Sure. We have to validate it. If we have a case that comes in, that case is being reported to our county in the EpiTrack system. It means it can come from a private lab, or it could have come from us at the health department running that test. I have to make contact with you as a person to find out, are you a resident within Leavenworth County, which means is your permanent residence here a majority of the time, and the time that the duration that you're going to be quarantined for Leavenworth County. What happens is someone home address could be recorded, say Tonganoxie, but then we find out that they're in a nursing home down in Johnson County, and that's where they were tested at. That case has to be transferred down to Johnson County to follow, because that is where they're.
And I think that's the number. Those are the 2 cases we took out.
Yeah, there's several cases that happens on a regular basis. As I receive in and report out 25 cases, there may be 1 or 2 cases that immediately are not. We have a lot of transient individuals that come to work here because we have prison staff, USP staff. We have people that live over in Platte County that maybe work here in Leavenworth, but their residence is in Platte County. Well, with that result, they may be tested with us, and then I have to transfer that over to Platte County because that's where they're going to be quarantined at within their jurisdiction. So that's why when we transfer out those numbers, that's why those numbers have to be transferred out. And that's why I say we validate our numbers before we put those out, is those are actually true cases and what caseload we are working with here in Leavenworth County.
Okay, so if it's their 3rd test, you're not counting that as a new positive case because they've already been counted. Okay. So with that, if somebody tests positive, then they're supposed to be home quarantined for 10 days if you're in Platte County. but 14 days are for Leavenworth County. I don't understand that.
Well, the study's just changed. That's a new recommendation.
The state of Kansas is a minimum of 10 days, which is a 7-day quarantine plus 72 hours of fever-free with no antipyretics and improving symptoms before someone can be released off of. So it's a minimum of 10 days. Some of that can be longer based on what those individuals. So that's why recovery is also, it's not just, okay, at the end of 10 days, release them, recover them. We have to follow them. We have to call every one of our positive cases every day to track their signs, their symptoms, they're improving, they're not improving, they're in the hospital. So every one of those that are on our active list get a phone call from the health department on a daily basis to try to track that. Now, do all of them follow all of our isolation orders? And no, there's some that we're finding are out running around, or they're, oh, I just had to run and go get a prescription. That's why I have told the board over and over, our biggest problem are individuals when it comes to following the orders of, you are infected, you are infectious, and you are spreading the virus. We need you to isolate. This is your isolation order, and that's why it's also so crucial that masks are, because when they are out, at least if they're in a mask, we're going to reduce what that exposure can be to our community.
Okay, so I've got a lot of employers that are confused because they're requiring a negative test even after the 14 days to come back to work.
Yeah, and a lot of times what we do, commissioners, we'll reach out to those employers, and the problem with trying to mandate a negative test, we have individuals that it can be 3 months out and you're still going to potentially have a negative or a positive test because of, again,
so can they go back to work after 14 days?
Even though the virus at that moment could be dead virus, we're still going to pick up.
72 hours with asymptomatic.
Correct.
What's that?
They have to be 72 hours with asymptomatic. No fevers, no shortness of breath.
Yeah, their symptoms have to be improving. And we can monitor them and we can release them based off symptomology. There's two methods. CDC at the very beginning gave us two methods. One is symptomology and time frame, and that's, again, what the Kansas testing protocol came out of, is going after two negative tests is one methodology. The other is symptomology releasing. And we went after symptomology releasing because of, again, I've had individuals that went that route, and we were on test 14 before we got two negative tests, and that was about 3 months.
Yeah.
But
we learned that in New York when they wanted the healthcare providers that were getting sick to come back sooner, and I know of several physicians that are 3 months out still positive.
So the 14-day is the rule, not two negative tests.
The 14-day rule is to monitor for signs and symptoms of somebody that has been exposed, and we're waiting to look for symptomology to show up. That once you are a confirmed case, you're in a different. 14 days is for monitoring in what's called persons under investigation. That's PUIs. That's a 14-day quarantine.
So
once we're in isolation orders, which means you are an individual that are actually tested positive for the virus, then you're under symptomology release, which is a minimum of 10 days, but it has to be the 3 at the end of that has to be asymptomology and fever-free.
So even if they test positive for 3 months, as long as they've quarantined for the 14 days, they can go back to work and not spread it to anybody testing positive for 3 months.
Correct, because again, those individuals, if they have already gone through and the symptoms have gone away and we've gone through the full recovery and release protocol, that testing positive, once they go into that mode, then we're in that mode of trying to test them, and that's why I say it was 3 months, because you're going after negative tests, and I have to still follow under that. We have switched over to the symptomology, releasing and recovery, because again, science, we know more data, we understand what we're dealing with.
So,
at the very beginning, we didn't know that.
So I guess basically my question is, employers should not need to require a negative test if they've been quarantined for 14 days.
And we reach out and try to educate the employer also. If an employee is having difficulty with an employer, we were on the phone last night with several employers trying to educate on what the process is and what has changed and why.
Okay.
Amy, I know in your office you only report on actual tests that were administered, positive or negative. Is that the same in the private sector? Seems like I hear from a lot of people that are calling their primary health care provider, and they're either struggling at getting them in, whether they have symptoms or not. They're not necessarily wanting to expose the office or bring them in for testing, and that's still something that I'm hearing regularly.
And I'll use Dr. McBrady office as an example. To not expose her office, if it's strictly COVID related, her office will call ours and we will run the testing at the health department. So a lot of times we will get referrals from the actual physician's offices here within our community. Dr. Yoko's office, Dr. McBrandy's office, a lot of the different offices, they will call us and we'll put them on, since we're testing 5 days a week and in the proper PPE and everything else.
Right, and this isn't specific to Leavenworth County, adjacent counties as well.
Sure.
I'm suggesting is the private sector, when they're reporting numbers to their county officials, is that 100% mean a test was administered? Because early on it was assumptions, right? We were saying, hey, if you have symptoms, we're saying you have COVID. But then we learned even people that had symptoms, only a 10% success rate on test. See what I'm saying? So very early on, we're saying 100% of people that are self-reporting have it, but of all the people we test, only 10%
testing that has
do.
become more readily available, we are trying to push the test, obviously more for confirmation on that, to be able to get away from probable cases. That's what you're referring to as probable cases versus actual confirmed laboratory PCR testing cases. More testing is available. Private sectors, all sectors within the state of Kansas, it is a 4-hour reportable. So if any lab is testing for COVID, that has to be reported to the KDHE within that 4-hour window of who received that test.
So how much of our numbers currently are private sector versus?
I have that percentage. I can get that to you. It's at a lot of ours. I want to say it's almost 80-20. 80 is coming from the health department running the test.
Right, and I think that's probably pretty unique to Leavenworth. I'm guessing if you go to Johnson County, it's about 95% private, 5% county.
Correct.
Yeah.
Right.
In Leavenworth, most of our not health department would be through the hospital. When you walk into the hospital, you get tested. For instance, my office, we got 12. We can test. We got 12 swabs. So I've tested maybe 4 or 5. Mm-hmm. I tested people that needed testing for their family members that didn't meet criteria initially.
Okay.
Can you help me understand the positivity rate and how that's figured as far as the rate of positivity tests? And could you explain it?
The positive.
We just use the same words you used last time, then I can butt in.
Positivity rate is based on the number of tests that are performed, obviously, to the percentage of positives that come out of that amount of tests being performed on those individuals. So I use the very simple. If we run 100 tests and 20 tests come back positive, obviously that is 20% positivity rate based on those 100 tests that were performed and what that positivity rate coming back. Obviously, the more tests that you run is going to show less as the number is. That variable will move depending on testing rate. Early on, as I showed in the example last week, we were not testing a whole lot. So our positivity rate was very high, especially when we entered that March-April month time frame. We were really only testing because of the availability of tests, the very sick. We were not able to test a whole lot of those probables and things that were coming up saying, hey, I think I'd like to have a test to see if I had it. We had to have very specific guidelines on what we could test at that time because of limited supplies and limited testing. That gave us a very high percentage. That is why we have seen, because of the amount of testing that we have, a lot of our percentage is coming down because we can test more individuals with very limited signs and symptoms, unknown exposures because of community. We can test you now and get that in, and that is why our numbers. We want to test. We want to see what our percentage out there of the individuals we're sampling out in our community. How much of that shows us what our virus exposure is within our community. So that's why, again, we are dropping or we are increasing, and why we're looking at very specific. Even if we go 33, we are still only at a 7% when we had that 33 in that one weekend. That was only a 7% positivity rate because there was 400 and some tests that were conducted on that day. And again, the more that we can go out and we can get these and we can test not only Commissioner SCHIMKE, we can test his family who's also exposed. So as we say, we're going back in. we know what that spread is and what that looks like also then to his children. So if Chad comes in, Commissioner SCHIMKE comes in positive, did he expose living in close quarters, everything else? We are getting some of that data. Is there spread to the family? Is there spread to his wife? Where has he been? Those are things that we can look at, and that's one of the matrix. And then we're also looking at the matrix. How many cases is the other matrix? How many cases are also just popping up on the day? Like I said at the beginning of this meeting, we've plateaued over about the last 5 days, if you really look at it. We were on a really high, and now we're just kind of hovering right here, which is a good sign that maybe, but we have to look at what that 14-day is going to look like before we can actually make any sort of matrix change out of recommendations, because again...
And for the physicians, is the goal eventually, I mean, when you talk about this herd immunity, is the goal eventually that we lower this curve, but we eventually, if we don't get a vaccine, you're going to have to get 60% of the people in the community.
There will be a vaccine. You'll question its effectiveness, but there will absolutely be a vaccine.
It's maybe 80%. The problem is, if it only lasts 3 months, it's going to be very hard to get a herd. Sweden tried that, and they did not get a herd. They had way more deaths. They thought they did not stop their economy. They asked people to social distance, and they did. They did social distance, which I don't think Americans would.
No.
And their economy got hit just as hard as other European nations, except for Italy, which is the worst. And they had way more deaths, and they did not get herd immunity, which they thought they would. I mean, it was an experiment. It just didn't work.
The Italy example is an interesting one, though, because as a demographic, it's a much older population of people. I would also argue that to live there, I think you have to drink wine and smoke incessantly. Like, those are two also requirements to be Italian. But that's a great point. The one question I have for the...
You can't say that about Sweden and Norway and Finland. And
Sure.
Sweden's death rate is way above all the other European.
Well, the first thing we didn't do was, one, thank you for everything that you both do. I mean, we thank Jamie all the time, but want to thank you guys. My I guess concern or question for you while you're here, because I know how busy you are, is my fear always in medicine is one loss of life is too many. Period. I mean, a physician is trained and by moral code to do everything humanly possible to save a life. I would argue that knowing what we know about masks, whether the effectiveness is 1% or 30% or 70%, even 1% is better than 0. And so you could make the argument that in 2019 or 2018, with typical airborne, viruses and flus and everything else, it's more effective rather than less effective. That leads up to my question as far as the medical community. At times it seems like I use this all the time, and since I don't have a better saying, is operation successful, patient died. Sometimes we're performing procedures at an incredible cost with a likelihood of success that's very low. From a business perspective, you'd never do it. And hospitals do have to think like a business, which is why we have one that closed.
You often wouldn't do it to your pet, but you do it to your parent.
Right. And so again, going back to this specifically, is where is that balance in the teetering to say...
The mask is very cheap compared to a COVID patient.
Agreed.
The amount of effort of COVID, just getting dressed can take 20 minutes to see a patient. So if you're in a medical emergency, we're taught to rush in. You can't do that anymore. We're doing so much medicine out of through the window. It's very exhausting. I'm not doing it because I'm not a hospital student anymore. But the physicians are exhausted. They don't like not touching their patients. The equipment we use for COVID is just, I don't know, maybe 20 times what you'd use for somebody with an appendectomy. I just made that number up. But it's a huge amount of equipment. It's exhausting. It's time-consuming. It's hot. And then every time you go home, you're like driving home. Is it okay to go home? Physicians are. I know a friend who's living in their garage in a tent.
Can I say one thing and then I got to run?
Yeah.
Okay.
Regarding testing, early on there was probably a difference in the quality of the tests the different labs were running and what the county was running. That's pretty much standard now. The difference is sampling. So if I don't get the swab in the back of my eyeball and tickle in that sucker, that's not going to be a good test. So if I drive through CVS and I get my home test, and I just swab the front of my nose, it's going to come up negative. It will, okay? So what we're doing at the county, what we're doing at the screening sites all over the city are good, reliable sample collection. That's huge. Huge.
Okay.
So the drive-through test, unless you're just really sadistic and ran that thing in the back of your nose, you're not going to get a great sample.
Dr. Willow, just a quick question on that, because this is the one that's been driving me nuts. How is one of the most contagious airborne illnesses that we've come up against? Do we have to run a swab through the back of somebody's head? I mean, it seems like we've been able to get it from a cheek swab. It's pretty painful. I mean, most feedback's pretty awful. Yeah, if you don't feel it in your ear, it wasn't good enough. Now, how why is that? Why does it come with incredible pain, yet the airborne and contagiousness is through the roof?
Because we can't. Viruses take 3 to 6 weeks to grow. Some funguses take 3 months to grow. If we had to grow it, you'd have to be in a level 5 lab because it's so contagious. So growing a virus takes weeks, and it's not safe.
Okay.
I mean, we couldn't. It would take. The test would be worthless by the time you got the results back to grow our virus. So we also do flu testing that way. We do flu testing that way. We do rhino. There's lots of viruses.
Dr. Willow, thank you. Thank you for taking your time.
10 viruses we check through. It's called PCR.
I have one last question to you about
Okay, yeah, we've been
HIPAA. How does HIPAA apply in this situation? You know, how does the HIPAA laws apply in this situation? So if someone had psychological claustrophobia problems of wearing a mask, say they had a medical doctor give them permission that they didn't have to wear a mask, but how do the HIPAA laws apply? So if you wanted to walk in the store, what's that?
You can't ask why somebody has a medical exemption. But currently they recommend almost nobody have a medical exemption. I mean, I can see an autistic child or an autistic adult, of course, having trouble. But I've had some children that I didn't expect to wear a mask come in with a mask. A physician has a 1-year-old who made herself a mask out of stickers because her siblings were in masks.
Mm-hmm.
So sometimes you can do more than you want.
So again, businesses can't require someone that doesn't have a mask on. If they say they have a medical condition, they can't ask what medical condition it is. And
you can't ask what medical condition. You could ask for a paperwork saying that you can't wear a mask. But I can't imagine very many physicians giving this exemption out, unless you're online.
The CDC says children under 2.
Right, because of safety.
Right.
I mean, you don't want a child getting hung up on a mask, vomiting in a mask. You can't rely on a 1-year-old child to know how to get rid of a mask if they're vomiting.
So, but you could probably at least understand parents' concerns with their children going to school all masked up.
I thought it was under 5.
Well, the
under
older
5,
children,
it was last week.
the older children are going to do fine.
Changed to
Our
2?
children don't. When they come in the office, they don't mind.
Well, I'm telling you that there's people in the community that don't feel that way.
Correct. I mean, most children don't mind.
Any other questions of Dr. McBratney?
No, thank you, and again, appreciate
Thank
everything
you for
you have
taking the
to
time
do.
to come in here and visit with us. Thank you. Mr.
Thank you
Miller,
for taking your time to come in, Dr. McBratney.
Mr. Miller, I just want to get the record straight. Commissioner Stevens, I had received an email. Tonganoxie 464 superintendent has not reached out to you, and you did not miss 2 meetings. I just want to get the record straight on that.
Correct.
All the other school districts have reached out to you.
I was on the phone even as of yesterday with Lansing again. I've been in contact. If a school district has reached out, I've been in contact as quickly and responsive. I'm even working with St. Mary's, the Catholic schools. So if they need answers, they can reach out. I was not formally given any sort of, we would like you here at this time or this place. There was no, so yes, to answer that question.
Thank you.
And that's been communicated to, I did communicate that to the president of the school board, so
Okay.
they know you're ready to meet with them.
And I am working, Commissioners, we were, again, as you saw, Johnson County just put out the Johnson County Health Department put out yesterday, their matrix, if you will, for what schools should look like in that red, yellow, green, or black, the complete remote. That's going to be something also that we're looking at here for Leavenworth to try to put together so that the actual school district has some sort of matrix to also look at what is the transitional periods for the schools to be able to use for making their decisions at their local schools.
Okay. Thanks.
Unfortunately, it's not enough hours in the day.
This is Commissioner KAAZ.
Go ahead.
Just for clarification, is the health department, our health officers, is the continued recommendation that there be an order in place for masks in Leavenworth County?
As you heard from the medical community, obviously from our medical side of things, everyone being in masks would obviously have advantageous. So obviously from our side, you heard from the physicians today, as we brought in today, that was my voice from last week even to today. Their recommendation is masks to this board.
Okay. All right.
Thank you, Jamie.
Thank you, Jamie.
Thank you.
Thank you.
Yeah.
Okay. All right. Is there any other administrative business this time, Mr. Lawfrey?
I don't have any.
I did have a question, Mark.
Sure.
On the resolution on the Call Valley, there have been some questions about subsection 2A, B, C. The requirement that the Call Valley rebuild the road to county standards, that is in the agreement, correct?
Well, there's no agreement. There's a condition.
Resolution.
Yeah, there's a resolution that outlines the conditions of approval, and one of those conditions is that they bring that road up to AASHTO standards for the design traffic. Yes.
Okay. That's, just wanted to get that out on the record. Some people are questioning that. Thanks.
Okay. Any other? Then we'll move on to the items on the consent agenda. Commissioners have anything on the consent agenda that needs to be pulled out and voted on separately?
This is Commissioner KAAZ. I need to have the check registry pulled out, please.
Okay. Anything else? Then I'll entertain a motion to approve the consent agenda with the removal of the check registry.
So moved.
Second.
Have a motion and a second. Any further discussion on the items on the consent agenda except for the check registry? Voting?
Aye.
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 All right.
Commissioner KAAZ votes aye.
All right. I'll entertain a motion to approve the check registry.
So moved.
Second.
Have a motion and a second. Any further discussion on the check registry? Voting?
Aye.
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 Commissioner KAAZ abstains.
Okay. All right. Thank you. Okay. Now we're ready for a approval or discussion on the QLS contract.
Commissioners, obviously one of the challenges we have, as we're all aware, is scheduling folks into the courthouse and to other facilities that the county runs during and also trying to deal with the COVID. Looking around at surrounding counties, at other counties in the state, at other options that private practice are using, I found that the QLS is the name of the company. They provide for the counties in the state of Kansas that are using scheduling software. QLS is what I could find the only provider being used. They are the only provider I could find that actually does a queuing system with an app, so that you can install an app on your phone, pull it up, you can see what the queue is at any location that has it, and that includes private and public. It wouldn't be just subscribing to our queue list. It would show them Douglas County, Johnson County. I think some of the pharmacies are actually using it now. Doctors' offices are using it. So I've reached out to QLS and asked them for a quote as well as a contract that would extend that for 3 years, because they offer a 10% discount if you lock it in for 3 years. And that's what I brought to the board today. I believe that its familiarity in Johnson and Douglas County makes it much easier for people to pick up and use here. And the fact that it has an app, which again is the only application I could find that uses an app with it. So I would ask that the board consider this in hopes that it would help us to then control access as we move forward.
Would this be an approved COVID CARES Act?
CARES
spending?
Act.
This would be an allowed expenditure with the COVID money.
Sounds like a winner.
I was going to say this is a no-brainer then.
So moved.
And well, do you I guess commissioners are familiar with it.
Right.
Okay. All right. Do you have any questions, Mr. Culbertson?
Yeah, so is this going to be permanent, or is this a temporary solution to the COVID?
This will be a permanent thing. They've been using it in Johnson County for 13 years. I think Douglas County's had it for 4 or 5 years. But they're in 13 different counties in the state of Kansas. But this will be a permanent solution that we can use.
But Jeff, to your point, if you were to go away from appointment only, for example, it could still tell you what the wait time is, even if you didn't have an appointment.
It develops a queue so that you, instead of walking up here and finding out there's a 45-minute wait, you get on your app and you enter yourself into the queue. It's not like an appointment, it's a queue, and then it tells you via the app you have 45-minute wait, you have a 30-minute wait, 15 minutes you should probably get here. And then the employees who are down will have like an interface on their screen that allows them to see that there's somebody in the queue and that they know that person. So like the take a number thing, that goes away. It's you use the queue, they just call the next person. And as soon as they click on that person, it lets the next one in line know, hey, you're next up.
If the take a number thing goes away, then how do the walk-in people get?
Well, what I mean is that the queue replaces the take a number thing.
Okay, I guess my question is, this is not going to replace being able to walk in the courthouse and see somebody. That'll still be an option.
People are not.
So will you be able to walk into the courthouse unchecked at some point in the future? No, we are in the process of, as we've discussed, of securing the courthouse similar to what the Justice Center has.
Like a metal detector and a guard.
Right.
But you can walk in without even getting on the queue.
But you would, but there would be, I don't know why you would do that, I guess. Why would you come and stand out here and watch where everybody else is?
Because older people are not going to use it.
Because they've been in the queue.
Because older people are not going to use it.
Well,
Can it be accessed from our kiosk? Could you
it's a
access
kiosk from any computer, from any smartphone.
So my
you
question
can
is,
access it through the kiosk and get on the
older people are not going to do that. So my
Right, but you're
question
going to have
is,
to have an interface where currently you pull in a number. You're going to have an interface that checks you in. So you got to push a button rather than pull a number.
just
I agree with you. They're not going to do it till they get here, but once they're here, they're forced to.
then they can do it.
Right.
So instead of grabbing a number, there'll be a marquee where you can go.
You'll enter the queue. Yep.
Just walk in. All I'm asking is, this is not going to eliminate a person's ability to just walk in the courthouse and get served.
right.
They'll have to just click on this instead of taking a number.
Right. They will enter themselves into the queue. The problem being that there may be 25 people ahead of them that aren't standing in the courthouse
No
at the
different.
time. They're
No different than taking a number.
like at the CVS or whatever. If you go there now, or Walgreens, you have the little kiosk. You're in the queue, or you wait.
Yeah.
Are we going to have a work session at some point in the future to talk about the security and securing the courthouse and what the policies are going to be? Or how do you envision? Are you going to make a presentation and present it to us, or how are we going to follow that up?
So I guess I'm not following you. As far as we've discussed that we're going to go to a system like the Justice Center. We've discussed it a couple times now. That is the goal, that we will have a system like the Justice Center where you were screened when you come in for security purposes.
Right.
The equipment we have costs on. The staffing, obviously, is something I have to work out with the sheriff, but we do have that included right now.
I guess what I'm asking is, like, are you going to be able to give us like a timetable, sort of, how it's going to be rolled out? Or
As much as possible. I mean, our goal is to try to get by the end of the year, because that's the money. The scanning equipment has to be purchased by the end of the year in order to use the COVID funds for it. So that right now is our target. By the end of this year, we would have.
But most security is going to have to be discussed in executive session.
Right. Yeah, that's why I'm not saying a public work session. Security-related issues would be an executive session.
So going forward, I think this is a great solution. What we currently have is a real challenge with people in tags. And so when I was talking with the treasurer recently, it's not even just the renewals, it's actually new vehicles. And I was shocked to find out as a percentage how many people are buying cars during the pandemic or did buy cars that are now trying to get them licensed and tagged. So our appointment policy, which was throughout the courthouse, sounds like we're driving transactions down to maybe 125 people a day because of the time that it takes to get up, to go outside, to find me a person, and then bring them in, and so on and so forth, versus when they're the taking a numbers solution. We're maybe dealing with 250 transactions a day, so we're a lot more efficient. So I think we need to have a policy. That policy is throughout the courthouse, plain and simple. I'm trying to figure out how to go from people sitting in their cars versus people sitting in the courthouse and still maintaining 250 transactions a day, and to do so as safely as possible, both for residents as well as staff. And so there's something in the workflow or traffic flow there that I think we've got to figure out, one of which could be working longer hours. And there's some concern about overtime. I go, well, pretty sure the budget relative to that shot as it is, with the income relative to COVID or lack thereof. So I thought part of what we're going to do today is maybe talk through what that could or should look like. This software is great, but this is like months away. Doesn't solve our problem today.
Well, first of all, I'm not going to discuss how one department operates versus another department. That's up to them to discuss that with you. I mean, I can't tell you how they run their department, and I certainly can't tell them how they should run their department. And when it comes to the point of an elected official, I would caution this board about attempting to tell an elected official how to run their department, because I think every case law that's out there would tell you that you can't.
I agree. So there's a difference between setting good policy
with them,
and making recommendations versus them having to follow it.
I understand that. So I think right now what we're doing is working in every other instance. It's just in the instance of there's this huge backlog because people were, one, because people of human nature, they wait till the last minute.
Sure.
Two, they got an extension, so rather than handle, there's a reason why the tags are renewed by alphabet, because they can divide it up throughout the year so you don't have 80,000 people coming in all at the same time. Well, the problem is when you extend that for 60 to 90 days, now you have 1 month, which everybody waits till the end of the week, even though they've been waiting for 3 months. So we have 4 months worth of glut that we're trying to push through in the last week. There's no good solution to that. I think when we get back to a normal, we get caught up with the people who didn't renew when they could have but didn't because of the extension. I don't know that this will be as big of a problem, I guess, is what I'm saying. But we've worked out a temporary solution right now, and we are looking towards a long-term solution, trying to find a long-term solution for what happens. But that's my take on it, I guess, at this point. And
I'm sure others have gotten phone calls or emails relative to, again, speed, and I'm trying to find out what is the best go forward, because at the end of the day, I try to share with everybody. I don't think anybody wants to come here. Generally, you're writing a check and you don't appreciate it. That's not uncommon. Now, we're singling out a particular department, but it gets 10 times the volume of any other departments. So, and I agree with you. We've got a problem that was created by the state. It wasn't created by Leavenworth County or any of the staff. I'm trying to figure out how to get us through the next series of weeks. And maybe this new interim solution is it. I just didn't realize how bad it was. It sounds like it's came to a head over the last number of days or weeks. I don't know.
Real quick, before we get too far off that subject, I want to try to help people understand what is the rule on car tags. So if you needed a car tag renewed, say your tags were up in April, how long do you have to tag that vehicle to get new tags? Is it 60 days from the governor's emergency order, 60 days from the county's emergency order,
November
60
14th.
days?
That is November 14th. However, people don't want to drive on expired tags.
Right. But April's are November 14th or?
March, April, May, June.
So 4 months. Say that again, March, April.
March, April, May, June.
What does that
have
mean?
The extension through November 14th.
Okay, so only people that their tags were due in March, April, May, and June got an extension.
And then people that purchased the vehicle January through the end of May have an extension based off of their month. It's different for each month that you buy it.
I'm trying to make it simple for people, so
No,
you
it's
can
not
make it simple.
simple.
Okay. You can.
So like if you buy it in January, I believe you have until the end of August. If you buy it in February, you have until the end of September, going all the way through. If you purchased a vehicle in May, the entire month of May, you have until the end of December.
So is that a month time frame, or what are you using to calculate that?
The state came up with it all.
It's just a flat deadline that
Yeah.
they came up with. Okay.
But if you bought
So
it
the
in,
state came up with it, so you know it's nailed.
Yeah.
so if you bought it in June, you're expiring in August based off of your temporary tag issued in Kansas. You get 60 days.
Okay.
But if you purchased it in June in Missouri, Missouri only gives you a 30-day tag because that's what their rule is. So they expire now in July, of sometime in July.
Okay.
And all July renewals expire at the end of July.
So July didn't get any extensions, and August won't get any extensions.
For the rest of the year, there's no other extensions.
Unless the
Okay.
governor changes it again.
Okay.
So the couple of things that to me seem clear is we have this huge backlog. It's obvious. We're not creating a very good customer experience, and to be honest, it wasn't that great beforehand. That's, again, nobody wants to come here and write a check. Let's just all get that out of the way. It's like lost luggage. It's never a good day.
Correct.
No one comes in and says, I appreciate what you're doing. So we can't just throw people at it because you've shared that there's a lot of training. Obviously, you just said it's not easy. So we can't just throw people at this problem. So the only thing I know what to do is more hours, which is overtime, which is budget. I think there's things that we could do as far as temporary help that maybe just deals with logistics and traffic flow. You don't have to know everything about the treasurer's office to make a phone call and say, hey, Curtis, you're up. Get out of your car where it's a nice 65 degrees and please come into the courthouse and write us a check.
And we do have people doing that. I mean, if we
I'm trying to get you more people.
Yeah, we tell them when they come in, and when I was handing out numbers, I'd say, we have at least an hour and a half wait. Call the office in an hour and see what number we're on. We have been doing that to try to eliminate some of the wait in the hallway. And then they, like I said, they can call and find out where we're at, and if they're close to their number being called, they can come in.
CARES Act funding could be used for the overtime, correct?
I believe it could. Since it is a
Because it
COVID-related.
wasn't created by, yeah.
Yeah.
My only concern is with the overtime. It's not that I'm against the overtime. It's just that this situation is not going to get any better through November. And there's an element of burnout here because I've got everybody working through their lunches. If I give them lunches, then I have empty windows, and that's when people come, is during their lunch hour. So they've agreed to keep their windows full and occupied so that they can serve the public, and I don't have empty windows. And they're working through their lunches. So when I've got people working 8 hours straight and then saying, okay, we've got 2 hours extra overtime a day, and even if we alternate it, at some point there's some burnout, and I'm not quite sure, how that will work. I'm already telling people they can't take off work. So do I tell them they can't take vacation until November? So
Did you have any luck getting a hold of past employees to see if you could hire some extra
I
overtime?
do have already one past employee. I called 2 past employees last night, and they have already accepted other positions. They're full-time positions. I have tried and contacted past employees.
Because I'm sure we can come up with overtime if that's what you need.
Yeah,
Yeah.
I'm worried about that.
Yeah,
Yeah,
extra people
yeah.
in overtime, we can cover that if that's what you need to
Right.
get this done.
And right now, it's not so much the overtime or budgetary concerns.
Mhm.
It's more the burnout, because there's no end to this until November.
Is there a way, how long does it take, is there a way to have an expedited training schedule and get some new employees in?
Well, I would have to contact the state at this point. I don't even know if the state is training. I will contact the state, but once they get their training from the state, it's a good 3 or 4 months to turn them loose.
Okay. Do you know what other counties are doing? Because everybody should
Well,
be
I
having a
contacted Atchison and I contacted Riley County, and they're just like, well, kind of sucks to be you, because we've been open since March 18th for walk-ins, or May 18th for walk-ins. So I said, well, we've only had appointments, since then. And they said, well, we've been able to do renewals and walk-ins since May 18th. So,
And
I
we're
really didn't get any help.
and we're working on right now being able to open up the west door so you can
Yes.
have walk-ins, right?
Right.
Is that correct, Mark?
Yes.
Okay.
And it seems like there's a lot of out-of-state vehicles being inspected out there at the inspection station. Have you seen an increase in that?
Oh, yeah.
And the
A lot of
annex-
purchases.
And the annex
Purchases.
doesn't have walk-in. You're not having walk-in at the annex.
We will next week. I really don't have the personnel out there, and I don't know how it's really going to work because I only have 4 people out there working the front line.
Okay.
So
And just a
do
reminder,
what we
people
can
can do everything online except a new vehicle, correct?
To a certain extent, it's like the perfect storm right now because we have personalized plates that all expire this time, and you can't do those online. They're an in-person thing now.
Of course you can.
Yeah. So that's an every 5-year cycle, but we're at that mark.
And some are having complications because there may be insurance issues. And if there's an insurance issue and it doesn't pull over, you can't do it online. There are different variables that may prevent people from doing it online. We try to encourage people, but they also get charged a credit card fee, and there's,
What do people do about inspections on the out-of-state title with the state inspection? How do they get that done?
They are open,
Right, just like normal?
just
Yeah.
Tuesday through Friday?
Tuesday and Thursday, go by there, and it's a lot.
Well, the
fuller.
hours here are awful. I mean, if you go to adjacent counties, it's several hours every day of the week.
So it's Tuesday and Thursday, 8 to
8:30 to
noon?
noon.
8:30 to noon, just like normal? Okay.
Drive out there.
Which is convenient if you have a job.
Yeah.
So if you were going to ask this board anything that we could do to help you make your situation better, what would that be?
at this point, just allowing the taxpayers in the building. We have found that the best thing that works for us is our number system, because we can get people just like this, one after another. We're not having people go outside to get another person.
Can you guys put some signs on all the doors saying
We did.
vehicle transactions, treasured stuff, go to the west door?
We did.
You already did?
Yeah.
Okay.
I ran
And
some
Janice, I
numbers.
get that, but we just had several health professionals that just cannot stress enough social distancing, social distancing, social distancing. I didn't go down and measure down there, but I'm guessing square footage, we're only dealing with
And
several
that's
hundred.
that is the disadvantage to being confined to one end. I mean, I'll take what I can get. I mean, if I could get, the opposite end for people to do adequate spacing, I would request that. If you say, if there's anything you can do for me, I would say, give me the opposite end as well, so
Can
that
you-
people can have social distancing.
Can you prop those doors open at the entrance and put a couple chairs out there, and then you can prop the door open to the staircase, block the stairway off, and you could put some chairs in there?
And it was pretty full this morning, but we had to send people away because the system was down.
Oh, okay.
And
So what was the primary problem with doing it the way we had before, with an appointment and you call?
Well, for
and
example,
come
the
in?
annex is on appointment only right now, and we're doing 62% more here in the courthouse, more work than the annex is doing by appointment, because we set the average appointment we set for 30 minutes because we never know what is going to be presented at that window, what type of transaction. It could take 10 minutes. It could take an hour and a half. That's the problem. Jennifer, do you want to elaborate on that more?
So when somebody comes up with a renewal, and for most of our appointments, they were all title-based or a Kansas title, everything's already entered into the system. So the Kansas title, that has been registered, it's there. But if it's a Missouri title or a title from any other state, it takes a lot longer to put those numbers in because you have to start back from the very beginning. Not a ton of time, probably 5 additional minutes. But if it's somebody even if it's a military person, then you have their driver's license that all have to go in from out of state also, which would take an additional 10 minutes. Just each transaction takes a certain amount of time, but it's never a predetermined amount of time until we have it in front of us. If you're missing paperwork, then dealerships have to be called or insurance people have to be called.
There are a lot of different variables you have to deal with, and You could get 2 or 3 of those all at one time from one customer.
When we train people, it's like every single transaction that we deal with is completely different.
But it's like when you go to the grocery store. Sometimes the person in front of you's basket is empty, and sometimes they got 300 things, and it
Right.
sucks.
With
Right.
coupons.
So you got 7 windows. If we do 250 transactions over an 8-hour day, that sounds like, what, 4 transactions per person per hour? So probably 15 minutes is more accurate rather than 30.
It all depends. I mean,
I realize you can't solve for the exceptions, though. That is our life. If you solve for the 10%, you'll trash the 90.
Well, I can give you an example. On Monday, we had 654 transactions. 296 of those were online. That left 358. 80 of those were mail-ins, and that took it down to 278. And then we divide that by 10 clerks on average, because that includes the annex, and that's 28 transactions per clerk per day, averaging 3.5 titles per hour.
I had 4 of those pretty close.
And that's working 8 hours straight.
But again, I get the issue of anytime there's a mobilization and demobilization, I got somebody at a computer, they're working, they're in their system. Now I'm getting up, I'm going outside, I'm trying to find number 9 or John
And that's
Doe,
what
or
has
whoever
helped
it is.
too, demobilizing them and allowing them to enter into the building. We also are taking tax payments. We took $66,000 in real estate tax in one day on top of that. So it's not only motor vehicle, there is tax payments.
We're looking for that scenario that sucks less.
Right.
Janice, do you have a problem with that Q-less, whatever?
I really haven't looked at it. I don't know anything about it.
And it's not going to replace people still being able to walk in. That was my biggest concern. People will still be able to walk in.
My concern is probably the elderly and their ability to use it, and will they use it, and
Right, and that was my concern. It's like they're never going to be able to do something digital.
I mean,
like
our
that.
system isn't broken. I like our system. I like our ticket system. It works for us in our treasurer's office. But I don't, I think this, in my own opinion, in my department, that's a long-term solution for a short-term problem.
Mm-hmm.
We like our ticket system. It works.
Well, in my
And
mind,
just get them through, and people don't mind waiting, as you can see.
right, but in my mind, if we go to the Q-less thing, where the tickets are, there's going to be a marquee, and they'll just walk up and push a button on the marquee screen, and that'll enter them into the system like getting a number.
If that's how it works. Like I said, I really can't form an opinion.
Well,
because
that
I
better
haven't
be the
seen
way it works, or it ain't going to
anything
work.
about it. No
Well, we're talking
demonstrations.
about security in the courthouse, enhancing it to where it's about like going across the street, to where you have, you can't come in here with a gun and getting it secured. So that would be an issue, of why we would move towards this other system, and we're all going to kind of have to work together on making that happen. And but we want to make it work for you the best, but I understand we got to get through this 4 months. And
You don't see that as an issue, though, having security guard and the metal detectors. I mean, that won't affect you.
Yeah.
And I would correct one thing, though, when you say they don't mind waiting. They tolerate it. They don't have a lot of option.
Well, at
To
this
be
point,
clear,
they're
nobody
so
wants to
desperate
wait.
to get their tax, they
Sure.
don't mind waiting. But that is not the norm, except maybe on the last day of the month. That this is not the norm.
And that's coming this week.
Right. It's Friday.
So,
Well, thank you for all you're doing, because I realize it's a lot of stress.
additional staff is that
See,
going to
that's
be
the problem.
possible at all? I mean, to get somebody trained?
I would like to say, yeah, I need more people, but I don't have more windows. I don't.
Well, that's another issue.
I mean, I have a couple of people that are just, stuffing envelopes and, doing what they
Okay.
can behind the scenes. But if I don't have more windows, I can't help more people.
So,
No, what we're trying to figure out is there are other tasks that your office does that is less complex, that might be more administrative. That
And
we
I
could
have 2
use.
people doing
We
that.
could use temporary help or whatever that looks like to make sure that we've got 7 windows open,
Right.
8 hours a day or 10 hours a day or whatever we need to do, short term, not long term. It doesn't fix the burnout, I assure you, but
Right.
we don't want to talk to the health department about their burnout either.
Yeah, I'm sure.
Or the road department lets know.
And I want to make sure that you understand when we're reaching out saying if you need extra money for budgets for overtime or employees, we can make that happen.
I appreciate that. We have lost some facility fees through the months of March through, July. And hopefully we'll recoup some of that during this time, but I'm more concerned about my year-end balance and what I'm going to carry over right now. Right now, I'm at $88,000 in the motor vehicle fund. So that, we're fine. We've been fine for a while. We only had to use 3 payrolls out of the general fund, which was better than I had anticipated. So right now, my concern is my year-end balance. And so we'll just...
And I share with you, that was a concern before COVID. It's clearly a concern through COVID. Now we got to figure out how to serve the public. So.
Well, that kind of originated from a previous board that made me transfer $100,000 to the general fund. Had that not happened, it wouldn't have been a problem before. So, having said that, I think I'll be okay.
We've got dollars. We're just trying to figure out, especially through the CARES Act, how do we help solve your problem? So we're all just trying to get creative.
Okay. Well,
but right now, to answer the public is, we are taking by appointment. We are also allowing walk-ins, and we're open from what to what, Monday through Friday.
In the treasurer's office, we are serving the public from 8 to 3. That gives them between 3 and 4 to finish up their transactions at 3 o'clock at the window. And from that time, they are sanitizing, putting things away, helping with mail, helping with onlines. So they are staying busy between 3 and 4. It's not like we're not letting them in and finishing at 3. They come in at 3, they finish their whatever transaction is at their window at 3. It could be 3:15, it could be 3:45, depending on whatever they dealt with at the time. So if they finish their transaction early, say 3:15, 3:30, they're working on onlines or mail or
so right now, at 3:01, we turn people away.
I'm sorry?
At 3:01, we turn people away currently.
Yeah.
And walk-in is open now through the west door of the courthouse.
Yes.
And starting Monday at the annex.
At the annex.
The annex will be walk-in, no appointment on August 3rd.
Monday the 3rd.
There's the 2nd, 3rd, whatever day it is.
Right.
Are those hours posted anywhere? Because I think that's created a lot of confusion, too, of people that think they can get here before 5
August
and
3rd, yeah.
finish their business.
It's
and really they
on
can't.
the door. It's on the door. We have not changed anything online because everything is changing here all the time.
But
So
online shows 2.
our online shows too, but that's when we were taking appointments. So not really knowing what was going to happen with our hours, allowing people in. We hadn't changed anything yet, but we will.
How many delinquency notices did you recently send?
2,500
Did we include any education in that notice?
education regard.
Like, I'm just thinking it'd been pretty easy to put a letter in there that says, by appointment, be here by 3, something that would help people to understand what to do. Because right now, if I show up at 4, I think the courthouse is open until 5, I'm pissed. I mean, that's me.
Yeah, well, they can put it in the Dropbox. Some of them choose to stay because their interest has to be calculated based on the day that they pay. So there are different variables as far as that goes too. A lot of times they'll call and say, what do I owe if I pay tomorrow? What do I owe if I pay next Friday? And, we encourage people to do that, and just drop it off. But there are other people that have other issues. Some people want to get in our tax escrow program and they want to talk to someone. So we just deal with a lot of different issues.
Sure.
Is the annex open Monday through Friday?
Yes.
Okay. And what time?
8 to 4.
8 to
They're
4.
doing what we're doing.
Okay.
But they stopped seeing anything new at 3.
The
No.
last appointment there is 3. Yes.
Okay.
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 And they're doing the same, not doing lunches.
Okay.
We are open for suggestions.
Well,
It's just, it's a bad situation, and hopefully it's short term. At least, it'll go on at least until November probably.
well,
Because that's when the extensions expires in November. But the
Are we-
problem is
so
people
to
don't
that
want to
point,
drive.
Are we tracking, okay, so here was all the transactions that should have happened that didn't between February and, say, May, And so we've got a backlog of 8,000 or whatever that number is.
I track that.
Right, and then now we're obviously catching some of those up. So at some point, every month is likely not going to be the same through November. I realize that they may have until November, but hopefully we catch up in the first month or two on
I'm hoping
4,000 of the 8,000. But you are tracking that?
Well, yeah, but the problem with that is those numbers aren't calculated until the titles are approved, and we're so swamped at the windows and onlines and mail-ins that the titles have been backed up and not getting approved. So although they're done, it's not registering in the motor vehicle system until the actual title is approved. So the numbers are a little skewed right now.
Okay.
Once those titles get approved, we can run the numbers, and I can get that information for you.
Any other questions, Treasurer or staff?
As far as delinquent taxes, we have collected $400,000 since I spoke with the board last. So we're down to $2.7 million delinquent.
Which it sounds like if you compare to 2019, though, that's fairly
I think the letters
consistent.
You're always going to have it.
Sure.
Yeah.
the letters that we sent out in 19 versus 20 were pretty much the same.
Right.
That's amazing.
Yeah, it was amazing, but it was very
Same
similar.
people too. So,
Amazing.
okay. All right. Well, thank you for coming up. Okay, and we were talking about the QLIS contract.
Yes.
And do I have entertain a motion to approve? So moved.
Second.
Have a motion and a second. Any further discussion on the QLIS contract? Voting?
Aye.
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 Commissioner KAAZ votes aye.
Thank you. Do you have anything else before the board this time?
I need to ask David a question, or Mr. Van Paris a question. Last week we addressed the governor's emergency order dealing with the school. The Attorney General came out with a opinion about the schools. The specific part I would like you to address is the private schools within the county.
Commissioner Stieben, members of the commission, I believe the Attorney General offered a statement. I have been able to find no official press release or opinion from his office on his website. However, it is my understanding that his statement was that the local schools had authority to either accept the governor's mask mandate or to modify it or decline to follow it. So that has been stated, and I believe, as I stated last week when you asked me that question, that the State Board of Education and the local school boards have autonomy that is separate from your authority. With respect to private schools, since they are not under the Board of Education or a local school board, while they may be regulated by the Kansas Department of Health and Environment with respect to certain safety issues, they would more or less be subject to any county-wide regulation that you adopted with respect to a specific health mandate.
So they would fall under since we exempted under the previous order on the masks, the private schools would fall into that exemption. My suggestion would be that they would most likely do so because they would not be under the State Board of Education. Thank you.
This is Commissioner KAAZ. Do we have any plan of moving forward with discussing whether or not we want to accept the recommendation of the county health officer and medical director, or are we just continuing to just do nothing?
Any thoughts?
Well, I don't think nothing's fair. I think we've recommended, we've strongly recommended. We've continued to have the professionals come in, and we're tracking the numbers daily.
And we haven't had 14 days since the stores have required, businesses required masks.
Yeah, I'm suggesting we continue to monitor the numbers, and they said the numbers have plateaued over the last 5 days. So,
With the big stores required masks, we contributed to that.
yeah.
And I do think it's worth reminding the public, the one that's here, Still, the vast majority of our cases are the correctional facility. Those people are as contained as you can be. Still, less than 1% of our overall population has tested positive. So, but that doesn't mean we're not still recommending masks. It doesn't mean we're not still tracking the numbers, and it doesn't mean you should treat every situation and room the same. You know, how you treat an 8,000 square foot room probably looks different than an 800 square foot room.
And if the businesses want to require masks to come in, that's fine. And if the cities want to pass a mask order, they can do that. It's where the congested areas are. I still feel like one rule doesn't work for the entire county. Just like one rule didn't work for the entire state, and one rule didn't work for the entire country.
Okay, this is Commissioner Cox, but the fact remains that we will be not not doing what has been requested by our local health professionals. That's the thing. I just need to make clear that that's the decision that is the consensus of the commission, because I personally support adhering to the recommendations of the public health officials.
Okay. I guess my comment to that would be, I'd like to, if Commissioner KAAZ, if you have a proposal or metrics that you would like to propose, and where the mask mandate, like what number would the mask mandate apply at, or when would it fall off? Would it be based on hospitalizations? Would it be based on cases? Would it be based, and that's kind of, we addressed that with the doctors. We kind of need to have a exact proposal that you are looking for on, because I don't want to see it like we just put a mask mandate in effect and we don't have any kind of statistical metrics that like, when does that come off?
They won't set one.
I agree with you, and I think that's something that we could ask our the health department to work on. We could request that Jamie work on that.
Okay.
I just think we need to move forward with having a plan in place if things do not improve, that we need to have something that we can base the decisions on, yes, but I just think that we need to do something that is more concrete.
Right. And I believe Commissioner Stevens did mention that to Mr. Miller and Dr. McBratney and Dr. Whitlow, didn't you?
Well, we brought it up.
It was discussed, but we never got it.
What's the metric? And I'm sharing with you that one positive, one casualty, one anything is the metric of the medical community, and that's what the medical community's job is, to save every life imaginable.
And I don't think it's fair to put that back on Jamie, actually, because he's already said, and so have the medical. They've already said that they recommend it because right now. So
but nobody gave a number.
Right. So
nobody gave 5 hospitalizations or 10 hospitalizations, or if it doubles beyond 5.
There's so many different variables too about how fatalities and everything else. I think you just have to monitor on an ongoing basis. But I don't know that it's fair to put it back on Jamie to come up with a matrix that nobody so far has been able to come up with.
No, I didn't say the federal government has
it. We discussed and nobody had a number. So I didn't know if that was
until the board supports mandated masks. There's no matrix out there that can change that.
Okay.
We have a call in.
Well, I'll just go on. This is Commissioner KAAZ. I will go on the record supporting the recommendation of our county health officer and medical director to mandate masks for Leavenworth County. And I think that they already use matrices, or they use information and data that brought them to the point where they felt that was necessary. So I believe that they do have some information that would direct that decision-making process, and that would probably place a limit on, the amount of time and what they would look at to say that was no longer necessary.
So are you going to bring that to us next week, exactly written up how you would propose it?
Well, I I could do that, yes, but it doesn't appear that would accomplish a whole lot.
And I would even ask for contact tracing information to see where they're communicating these cases, and if they're all in the cities, then maybe the cities should pass a mask order. Or if they're in the county, then we can revisit that.
If it's out of Easton.
I'm watching you.
And, well, I will say one observation, because I've been really out in the community a lot recently, and I will say I believe that we are just voluntarily having a lot more compliance with the masks. When I go to the grocery store, when I go to
My point exactly. The voluntary system we have in order is keeping our numbers low.
and I would like to have another metrics. There's all these metrics, but I'd like to see, compared to the 91 counties that don't have a mandate, compare that to the counties that do have a mandate, and are the cases lower or higher? I mean, anecdotal evidence would say that probably the cases are higher in the counties that are mandating the masks, which is counterintuitive. But
Personal response?
And this is Commissioner KAAZ. I understand all of that. I just know that, one of the things that the commission is charged with is maintaining the public welfare and safety. And so when we had a recommendation from our public health officials to move forward with that measure, I just don't want to see us come to the point where something happens to where there's even stronger recommendations that come forward to us.
Okay.
Noted.
Okay. Anything else? Any further discussion on this?
We have a call in.
Okay. Then we have one public comment at the end of our meeting.
Your call has been forwarded to an automatic voice message system. 913.
Maybe we don't. One more time. Maybe they're screening. Try one more time.
He knew we were calling.
I'd like to finish that.
this is Becky.
I think they'd be watching.
Do we leave a voicemail?
This was the commission.
Try next week.
Your call has been forwarded to it.
For the record, we tried twice.
Tried twice.
I
Okay.
thought somebody was soliciting for a vote. That's
Yeah,
all
the
phone calls I'm
robocall.
getting right now.
So, all right, now next week we'll have our regular meeting. Are we going to have to schedule the week after a special meeting to canvass the election?
I think that's what the.
But we don't know what day that's going to be yet.
I think she
she'll
said
probably bring
Friday.
that in I think she'll bring that in next week for just
Okay.
that, but I think she was saying Thursday or Friday.
Okay. All right. And
And the clerk is accepting walk-ins now, right? As far as early voting?
you got to call in.
By
Call
appointment.
and they
By
can-
appointment, call and come
It's
get you.
not an appointment. It's a call when you get here. We'll walk
We'll
in.
walk in, walk
Okay.
you out.
What are the hours on that?
Because they only have one person in that room. That's
Call till
8
5.
to 5.
8 to 5. Okay.
And you get a free pen.
A free pen.
Compliments of the state.
Wow.
Yes, they are doing free pens. Because
Not stickers.
No, an ink pen. They're
Oh,
not pens,
oh.
too.
you sign with a stylus, and then you get to keep that pen. They don't want to have to sanitize it before they hand it to the next person.
Oh, well. Another reason to vote.
There you go.
And I didn't have anything to vote for
Going
until now.
to work.
So
Right?
it is a very nice pen.
It is a good pen. They're not low bid. So,
Who got the
I guess they
pen
needed
contract on that deal?
They needed to make sure they worked, I guess. So,
We got a sponsor.
all right, the Port Authority, you going to be able to zoom in on that?
Yeah, is it today or tomorrow? Today?
That's today.
It's on my calendar, yeah. Today or tomorrow.
It's either
Today. Yes.
11:30. Okay. All right.
Jeff, you're going to sit on that today?
I'm going to be on it, yes. If you'd like to join, please do.
Well, I didn't know if Commissioner Culbertson was interested in sitting in.
Yeah, it's a call-in, right?
Yeah, Zoom.
And Kamala Leonard reached out and wants to sit in on it too.
Okay.
City Commission.
So Commissioner Culbertson and Commissioner Shimke will sit in on that?
Yep.
Huh?
Be the two commissioners.
Two commissioners, right? Yeah. I thought you said you two, and I was like, no,
No,
we
no,
can't
I
do
said
that.
it'll be the
I said,
two.
We can't do that. But that's all right. All right, then I'll entertain a motion to adjourn.
So moved.
Second.
Aye.
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 Thank you.
Thank you.